Well, with a possible intervention looming in Britney Spears' immediate future, what can her family do to ensure Brit's success at recovery? Joining us now to talk more about the family's involvement is crisis intervention expert Marty Brenner. Marty, the difficulties that the family will face in this intervention, are they exacerbated by the fact that not only is she an adult, but she's a huge celebrity?
For sure.
How should they deal with that?
Well, first of all, it should be private. And that will be the most difficult part of the whole thing, is to have this intervention done privately and doing it the right way.
Seems like that would be impossible with her life. People are shooting in the windows, shooting in the cars with her. Why is it so important to be private?
Because the media is making it's not making a joke out of it, it's making it where everyone's involved and no one can get involved. People who do it is coming from a loving place. It's coming telling you, we love you, you need help, we want to help you. You can't do that in front of the paparazzi. They're not going to give them the opportunity to send and say what they have to say.
And isn't it true that also in an intervention, there's nowhere for them to run, nowhere for them to go? I mean, with Britney, she could just run right out the door and run into the arms of the paparazzi, who are like her second family.
Well, in a normal intervention, the people who are getting involved in the intervention will have everything. They'll have a script. They'll have their letters written telling them how they feel, what they've seen, how they feel about what's going on. They'll discuss, this is what you've done, this is what you're leading to, this is what we can't, and this is what we're afraid of. You can't do that. It'll be in a closed, secluded room, okay, where there shouldn't be any paparazzi. And if there is paparazzi, no one can tell them how it really is, because that will be lost. Yeah,
absolutely. Well, I wanted to ask you about the idea of, it seems like she's more of a mental illness case. I mean, that's the word on the street, so to speak, versus addicted to drugs, although I'm sure drugs have their part. But it seems more mental illness, possibly a bipolar versus substance abuse?
An intervention's an intervention, be it alcohol or be it bipolar, or she shows signs of bipolar. I'm not a doctor, but she's showing signs of bipolar by being depressed and by being manic, and people love the fact of being manic. They're up there, they do all the craziness, and that's what they like. When they come down on the depression, then they use the drugs. Then they have to address the issues of, I'm feeling angry, I feel guilty, I have no trust to anybody, and then they start doing that to cope with life.
Thank you, Marty. Thank you so much. Great to see you. Right now we're going to check in with Chris, who's got more on Heath Ledger.